Hi, this is Dr. Victoria Andarcia with Healthful Roots, and I have a special guest today, Dr. David Wahlberg, one of my close friends from residency. He is a rheumatologist. I'm going to allow him to introduce himself, and then we're going to be talking about meditation, medicine, how our practice has changed, how we view and practice medicine, and anything else that decides to pop along the way. All right, David, take it.
Hey, Vicky. I'm glad to be here. Appreciate you having me on. My name is David Wahlberg. I am a practicing rheumatologist in Carrollton, Georgia, right outside of Atlanta. Went to residency with Vicky, FAU. We finished in 2021. After that, I came to Emory in Atlanta to do my fellowship in rheumatology. Finished in 2023, which is crazy. Almost been like it's going on a year of being attending right now, but yeah, it's kind of like a brief blurb about me. But I'm glad to be here.
Yes. And so I was a little bit further along in residency when David and I met.
Yeah.
I was in my last year and he was starting his first year. And uh, I met you before the story started, right? So it
hmm
was my
My
first
first
week as a
rotation.
student and your first rotation.
Yeah.
Um,
And you were
and
the
I,
senior on the opposite team. And looked peaceful
yes.
over there. Yeah.
I was a mother hen.
hmm
Um, and then I think it was a couple months after that, I was super ballsy and decided that I was going to talk about my struggle with anxiety and meditation. And I don't really remember much about what I said during that time,
Yeah.
but something from that stuck with you. So, what was that?
I mean, being a first year doctor, you know, coming in with different expectations in your mind, but also kind of going through the ebbs and flows of learning how to be a doctor post medical school. But I remember when you gave that presentation, and I've heard of meditation before. I've tried it intermittently during, say, medical school, but I was never consistent. But to hear someone be very open about what's going on with them personally to a group of people, it kind of like hit me it resonated with me a lot at that moment. But I mean, the key things I think I took away from that presentation was just the honesty you had and being in that time and kind of learning again how to be a doctor. I was like, I really need to like settle and calm my mind down in some way, right? Doing physical activity and working out, but this is a muscle too. So I don't know. From that presentation, I think it was more your presence and your openness about, you know, and going through anxiety, going through this whole process to where I'm like, yeah, maybe I need to tap in and get a little bit more information about this stuff she's talking about. So that was like my first, like, I guess, eye opener to you and just, your realm and thoughts about, meditation. Kind of strung me along after that, Vicky. Not strung me along, but I gravitated towards you, put it like that. Yeah.
Yeah. I think I had just finished reading one of Brené's Brown, one of her books on vulnerability. So I
hmm
was like, yeah, I'm going to do this. I don't think I would have done it if I hadn't read that book. But
Yeah.
I think the other thing too is like realizing that I was talking to different people about my experience and that everybody was feeling the same way, but nobody
hmm
was talking about it.
Yes.
And I
Yes.
was just like, this is so strange because I can feel
hmm
like even though we're surrounded by our co residents and so many people, it felt very isolating.
I mean, medicine is like that, right? You have to be strong, tough, and which I get it, right? You're dealing with sick people. It's a complex field to be in, a lot of information coming at you at once. But realizing, like, hey, even from say the demographics, right? My background being African American and hearing a male as well in medicine, but hearing a woman speak so positive and very strong about her situation in medicine, I'm just like, I'm feeling the same way. Is this a universal thing? Um, but again, as you said, in medicine, everybody's like so stonewalled to a certain degree, right? I have to be the tough resident. But I mean, we all from that moment, not really from that moment, but that moment added on to kind of allow me to understand that we're all somewhat going through the same thing. It's just some people are more vulnerable than others with it, right?
Yeah.
Yeah.
And so do you have a meditation practice or did you develop one after that?
It was bumpy. It was a bumpy road. First, you start off, you're like, okay, I'm gonna do this for 3 minutes, and you realize 5 seconds in, your mind is just going, going, going. So the word practice is a key thing. It's a practice. You have to do it daily, right?
Yeah.
So I started off with a few apps. I think I did. what was it? Not Calm. What is it? Headspace was the first one, right? And I think they had like this
Yeah.
promotional program. They gave you free, I think, 6 months for students or something like that. And it was helpful, but again, with the busyness of intern year, I was like falling short with staying consistent with it. But it wasn't until really, I think, to be honest, my third year, um, I just got on a pretty strict regimen to where I would wake up in the morning. I'm doing 5, at most 10 minutes. Sometimes when I go work out, I'll do it in a sauna. And that's kind of been my consistent thing since maybe my third year of residency of, practicing meditation as and also trying to find new forms of it as I go along. But that 5 to 10 minutes in the morning is like my consistent like time period for it.
Okay. And with that, did you learn anything about yourself?
All these thoughts coming out at you. You learn a lot about yourself. I mean, those inner voices. I mean, just the racing thoughts you have going through your head, right? What is anxiety? Anxiety is you have something that's coming up or something that's going to happen in the future, but you're thinking about it at this very moment. Why is this causing stress and anxiety in my life at this very
Yeah.
moment? So you learn about what causes or increases the stress levels, those thoughts. But I think to answer your question directly, I learned that I'm a complex person, a complex human, that
Hmm.
I needed to kind of really sit back and I won't say reevaluate my life, but put more effort into building my mental strength or improving my mental health at that time. So that was something that really came to up front to me at that moment.
Yeah. And I think I like, for me, I resonate with that part that you said, um, where you're realizing that you're getting ahead of yourself,
Hmm.
right? And so I feel that in sensations, right? I always said my stomach would get so messed up or I'd feel like pounding in my chest anytime I got anxiety. But then
Hmm.
it's like I would feel that and I'd be like, wait a second, what's going on? And then I'd be
Hmm.
like, oh, okay. And because it was that awareness then, right? Like,
Yeah.
oh, there's nothing happening right now.
Hmm.
It's I'm getting ahead of myself. And immediately that thought, just like, oh, okay, there's nothing to worry about right now, would calm it
Yeah.
down.
Yeah.
Right. So I
Yeah.
think that for me, it was just like bringing awareness to the moment because I think a lot of times people, they get carried by their feelings. Right.
Hmm.
And so they start feeling anxiety maybe, and then it just kind of ripples forward. Right. And then they're like, oh my gosh. And then it gets out of control. But it's just having that awareness like, oh, I'm fine right now.
Yeah. No, I mean,
That's
it's just not to cut you off, but like you said, it presents in so many different ways, right? Like you say, sometimes physical symptoms that may develop. I think out of my entire life so far, I can only remember one time having a true quote unquote like a panic attack in the sense of like feeling like, oh, I'm not in control. It was brief. It was a period during medical school, it was my first year, I believe. And that was like the first time feeling the actual true physical symptoms, right? But I know me too from like going along, understanding how sometimes my anxiety presents. But it's crazy. Something else I learned about myself through this process is my defense mechanism, right? So if I feel something coming up, or I feel like I'm pressured, or just this anxiety's been bubbling up, I get into this mode of like shutting down and like, hey, just kind of blocking out the world, which isn't good. But it was like the coping mechanism, right? It's me tying like, why the hell am I like so resistant to everyone? Not being mean and like say nasty in any way, but just kind of shutting off, right? That was me realizing my physical manifestation of it as well, just the pressure, but also the coping as well, which is it's not it's good for me to a certain degree, but not good overall, I would say.
okay. So I would say it's helpful in circumstances where you're being overstimulated, right?
Yeah,
And you have
sure.
to like shut that down. But
Hmm.
is it like a numbness that you feel like we're
Let me say a numbness. It's almost like a I don't not like a aloof or just I feel
indifferent?
yes, that's the great perfect word, indifferent in a sense. And I mean, it would reflect in a way I feel like I would get better say at the work I was doing, whether I had a task to do or I was focused. But personal relationships with people, and it was spill over into that area, right? So I mean, that kind of identifying that kind of helped me really work on different things. Other won't say defense mechanisms, but other ways to manage, say, the anxiety, because we all are going to feel anxiety.
Yeah.
No one's exempt from anxiety, right? It's just the
Mm-mm.
spectrum and the level of it you experience.
Yeah.
Yeah.
Okay. I agree. All right. And so then my next question is, 'cause this happens to me all the time,
Mhm.
where I see a patient and I'm like, man, this person needs to meditate. Right.
Jesus.
Um, but meditation, has it changed the way that you practice medicine or the recommendations that you make to your patients?
1000%, right? I mean, to be honest, meditation, one of my attendings at Emory, I remember she would, smartest docs I ever met, right? She's an IgG4 disease expert, and she would tell patients outside of giving the medical regimen, but she would write a prescription for physical activity, meaning you need to do this at this time, this day. But it was like almost quote unquote a prescription, right? But she would also add sometimes like mindfulness and meditation practices. I somewhat, in a way, in my practice, always try to at least sneak it in during the encounter. But even more, say if it's a follow up, I leave at least five, uh, sometimes 10 minutes, depending on the disease activity, what kind of case it is, to talk about exercise, but even more meditation. Because, like, if you don't have control of this mind or some awareness of what's going on, let's start there, just having awareness that there's things going on, right? It's your body and everything else won't follow, right? So if I tell you to take this medication and say you're having some depressive state, the compliance, I mean, there's data to show like compliance and patient outcomes are worse with patients, say, with depression, anxiety, and mental health issues. So no matter what aspect of medicine you're in, I feel like you have to present or talk about patients or talk with patients about just their mental state because man, it's you won't get the outcomes. You'll just get a and it's hard too, right? It's hard to lead a horse to water, but you can't make them drink, right? To get patients
Yeah.
to commit to this. But I think every visit, I just keep emphasizing. And I mean, to a certain degree, I try to be a example of what I'm preaching. I mean, I can't
Mm.
show them I'm meditating in the office with them every visit, right? Sitting down. But say for my physical activity, like run a half marathon, just different things to say, you need to keep this state up, right? So yeah, I try my best every visit to kind of introduce that or
Okay, so
reintroduce.
I'm gonna ask you this because maybe patients don't realize, but
Mhm.
from what you've seen and what you know, do you think that being high stress, high anxiety can worsen or trigger um like flares of autoimmunity?
1000%, 1000%. I mean, if you look at like a lot of times, so what's the demographics of autoimmune disease that develops? Usually young women, childbearing age, right? One of my first patients as a resident was a young girl, had flare lupus or RA, but she was in college, right? It presented during a high stressful time. And it's a common theme, right? Either
Mm-hmm.
it's stress from, say, an infection. So when you think about autoimmune disease, you have some genetic predisposition, right? But then you also have some environmental trigger, whether it's, and it's usually a stressor, right? Whether it's stress from, say, psychosocial things, financial, I mean, infections, medications, other comorbid conditions. So stress is like the major factor to flares, or even if you're not flaring, the perspective, the thought that what I'm feeling right now seems like a flare, right? It could just be an anxiety or panic attack, right?
Yeah.
But at the end of the day, to answer your question, it's a major component to uh, flaring just autoimmune disease, just activity in general. Because what's one of my main complaints when like I have a patient, again, these college age patients that are getting sick, school stressful, and I need taper prednisone or I need to have my medications adjusted. And I mean, I've been in practice from outside of my fellowship to a year, almost going on a year of being attending. I've seen that, I mean, more than half of my cases, I would say, of true autoimmune disease flares.
Okay. And in your training, did that ever come up? Like, did your attendings talk to patients about that, or is it hard to do?
Um, it, I mean, medicine's so, it's so by the curriculum, right? So,
Yeah.
you have this patient, COPD, heart failure, boom, 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 boom. You read the data, the literature. I mean, they call it what the hidden curriculum, meaning like the mental health. I mean, we go through psych stuff as well, but we really don't delve into it unless you say directly involved in psych, right? Since internal medicine doctor, you have to be with a jack of all trades, right? To a certain
Yeah.
degree. But kind of answering your question, attending while doing training, it would be very rare. Maybe it's a patient that was struggling through, readmitted to the hospital. Might have to say, I can't say I remember an exact moment of the attending, but I'm pretty sure there was moments where we actually just sat and talked with the patient at a one time. But I think the overall concept of like it being a normal thing, it's not, right. We just have a list and we try to get through them and make sure we're doing right by the patient from the medicine standpoint. But it's not a prominent thing from my experience,
No, and I
unfortunately.
think, yeah, I think for rheumatology, that's extremely
Mhm.
important. But all right, so I guess a more personal question for you. So what
Yeah.
are your like wellness non-negotiables? What are things that are part of your wellness routine?
Ooh, really, journaling is one big thing for me. I have to, one, it's a great way to manage anxiety, right? So if I have these racing thoughts, if I can physically put them out on paper, that's one step, right? I'm putting it down, right? So journaling is
Mm,
one big thing, but also just writing sometimes about my thoughts, right? Just kind of, again, physically putting it out. So task, I have to label my tasks. And also sometimes I just need to write out different things, right? I have my book literally right next to me as we speak. But that's one of my main wellness non-negotiables. Have to at least meditate. I give myself at least 3 times within a week. I
yeah.
would go for every day, but understanding being a physician and seeing high volumes of patients and living life, it's sometimes difficult. I'll say the last thing, which really should be 1A, I guess, or 1B with the others, is physical activity, right? If there's anything with data driven stuff about just mental and your physical improvement, how it all correlates and relates to one another, exercising at least, I mean, I'm go for daily, but it's going to have to be 5 times out the week at least. So, I mean, with those combination of things, and as well, which I need to get a little bit more better at, is get back to my books.
Mm.
Actually, was which book I just recently picked back up. Uh, you actually referred it to me. The
Was it the untethered soul?
no, I reread that all the time, at least once a year. Actually, I bought the audiobook with the complete like quick synopsis and breakdown just to kind of get back into it. But the ultimate, what is it? Geez, this orange and anyway, it has some great chapters, and I like the bruteness of it in a sense of like it. I'm gonna think of the name. It talks to you about different concepts just about life, but it also like have kind of grounds you in a sense. It's the ultimate man, the way of I literally have it on my
Oh, was
audiobook.
it is it the data book?
Yeah, give me one second. I literally was just
Yeah.
looking at this.
Was it the one about
Oh, the way of the
mastery?
superior man. Yes. Yeah, David.
Yes.
Yes. And it's the title would kind of mislead you, like, oh, it's just something about say men. It's like no, it's about just human being stuff, right? They just use the
Yeah.
title of man to kind of, I guess it's being generic, but it's a great book. Like I said, I have it on the audio book and kind of revisiting those chapters, and it's very grounding. But just kind of going back to your question, that's like my fourth one. It's not as
Yeah.
strong, but books or say content, podcast, videos, something that's going to stimulate my
Yeah.
mind because it's like a million things of information out there, right? But things that will help build me as a human, just be a better human being, right? Not even just a better doctor, but just a human being. So that's like my fourth.
Yeah, I
Yeah,
like those. I like those, especially the one about like learning, right? Because there's so much we
yeah,
don't know. And I think it's a really helpful way to learn more because you can tell a patient in the office, like, hey, you need to meditate or you need to exercise, but like finding resources for yourself to like really delve into this is super important because you don't really grasp it until you immerse yourself in it. And I love that book too, by the way, David.
yeah,
David.
yeah. No, I remember you was kind of raving about it. I was just like, me going in. I have the physical copy, but I think you gave me the physical copy. I still have that, but the audio just when I'm like, say, running in the morning or something,
Yeah.
or it's a amazing. I recommend it to anyone out there that's just either need life guidance or just steady in their life and just want to build. It's a great book to have, though. You
Yeah,
know.
it is. It's well, I was raving about it because it triggered me.
Oh, I remember you told yeah. I remember
I
you
mean,
said
at
that.
first. Yeah, but
Yeah,
so it's about like masculine and feminine energies.
yeah.
And I think like sometimes we can take those two things very literally.
Yes,
Um,
yes. Yeah, yeah,
and
yeah.
it's not a literal thing because I can be in my masculine at work, but that doesn't mean I'm like masculine. It just means like these are energies that we use interchangeably. So yeah, you have to.
Definitions, man. People can be so, I mean, literal in a sense. I mean, when you hear masculine and feminine, you just think male, female. It's like more in depth to just human behavior.
Yeah.
But I'm glad you recommend it, but it's a great book though. Probably end up reading it
Well,
some today.
and I don't know, do you think that you have to be like on a spiritual path to understand the masculine and feminine energies in the book, or do you think that anybody can really understand that?
I remember we talked about this, like when if you're on a path of trying to enlighten yourself, or you are enlightened, I guess.
Yeah.
But you think about people that don't want to reach out and kind of get in the enlightened space. Is it more easier being kind of oblivious to it versus like, because I think about it, like, right, we're sitting here talking, we're aware of things, we're like, oh, our emotions and things that could trigger us. I mean, I'm pretty sure it happens to a person that's quote unquote not trying to seek an enlightenment, but I'm pretty sure they're less is react, they get less triggered or less sensitivity to this stuff because again they're kind of oblivious. But
Yeah.
to answer the question again, do I think you have to be enlightened and to kind of understand and read a book about this? I don't think so. I think it has some decent grounded principles, like just really straightforward and like, hey, this is that. But I think to really get more out of the book, having some path to wanting to be enlightened will definitely you'll get more out of the book if you're definitely on this path, put it like that.
Okay. I know like we just went on a tangent, but the reason I'm bringing it up is because I do think that part of the issue with, I mean, in general, I think our population is getting more sick, but you
Yeah.
brought up autoimmunity and how it affects women more. I
Hmm.
do think that we have strayed very far from, I would say, our essence,
Hmm.
right? I think that a lot of women are performing in more of like a masculine energy and don't give themselves like space to relax,
Yeah.
right? And I do think like if you're looking at it from a spiritual sense that that can be one of the things that you kind of have to relearn, right? Like myself included, I don't think that um it's not easy when you've been, and especially in medicine, right? Like you're just like on the go all the time in your masculine energy, telling people like, hey, this is what you got to do, this is what we're going to do, there's an emergency, you go and you handle it,
Yeah.
right? So then when you go home and you're just like, oh, let me like just be in my feminine, like no, you don't relax. I don't know how to on a day off, like I'll just like start cleaning the whole house and like
I
do
think
20 to do things, like
I think
you
that's
just
just
can't.
being a doctor. I'm not gonna lie. Like on my day off, like yeah, sometimes I was, oh, I'm gonna do this, I'm gonna just hang out. But then I'm like making to do lists as well. And that's another thing where I'm like, I need to meditate because if I don't meditate, it's a auto program, right? It's like, yeah, I'm off, but I could things I can get ahead by doing this today or doing that or who is it? It's a bit. So I do think you need to be enlightened. You can't
Okay,
answer that question. I
so
think you are in search of it, right? In search of it.
yeah. Okay, so I'm gonna ask you a good question. One of our good friends asked me this week. We were talking about it. So what do you feel, or how do you feel about being bored?
Whew. Oh, I mean, I
Or
wish I had more. So I guess being bored could be in some way of just being present.
yeah.
Maybe it's not parallel, but I would love to just be bored some days. Like, right? So
Yep.
working on do I need to stress about me not completing my courses to get certified in scuba diving right now? That I haven't got, why? So, but I'm saying I should just be present some days. But that's on my list as well. Still teaching myself the keyboard. I picked it up during COVID time, right? But I'm not meeting my goals of that. I wish, I guess we can use bored in a way of replacing just being present. I need to be just more present at moments. And let me actually step back. I think bored and present are two different things, right? Bored is almost like your mind is blank or you don't have anything to look for or do within, say, the near future, right? I think that's
Yeah.
more of the place for bored. I think being present is like, me and you're talking right now. I can see your eyes. We're interacting. We're speaking. I'm engaged. You're hearing me talking, and you're reacting. It's, ditto, same way back. So I think being bored, maybe I don't want to be bored. I think I want to be present, if anything, right? Just whether it's watching
Yeah.
TV and you're still engaged in that, I think that's more of the I guess definition of phrase for me.
Okay. And I agree. I mean, it's just I've been thinking about it since this person asked me or mentioned that they were bored, but I was thinking that's also a practice because there are
Hmm.
times where you could say I don't have to do anything right now, right?
Hmm.
But then you're like, oh, I'm bored, or you're not, we're so used to being overstimulated and like doing stuff all the time that when we have that moment where we're like, oh, I have nothing to do, it's uncomfortable.
Yeah, yeah. I
And I
mean,
and I think that's why people struggle too with meditation, because when your mind is not used to that presence, it's almost like the anxiety at first was going to be worse because it's like I'm like, what's happening?
okay, you're not conditioned to doing this or quote unquote being bored as often. So when it hits, it's like versus like working out, you're building that muscle up. Like, okay, I meditate. I hear the anxiety, I hear the thoughts and things going through. But if you try it initially as a new person coming in, like it's going to work on the first day, right? Then boom, it
Yeah.
hits you. So
I've
I've been,
had patients tell me that they get more anxious when they sit down to try to meditate. And I'm like, that is an indicator that you need to be meditating.
yeah, yeah, yeah. I mean, actually, when you said bored, right? You said it's more of a, I mean, it's more of a state. Maybe what kind of would say that again for me? Would you
Well, no, I just said like I think it's something that like being bored is something that we to practice. I mean, I've never been bored.
to practice?
I, yeah,
How do
like
you practice? Like that's like
so I think it's just being okay with not doing anything. Right? Like why do we constantly have to be doing something? Why can't we just and it's like what you said, why can't we just sit outside and look
yeah.
at the cars pass and be like, "Wow, I am enjoying my company." Why do we have to then like cuz I guess bored has a negative connotation to it, right? That's a
Hmm.
negative connotation, but I would say that a lot of people when they feel that stillness,
Hmm.
they get uncomfortable and then they're like, this isn't good, I'm bored. Why does it have to be like a negative?
People define it in so many. So I can see what someone's saying. I'm bored in the sense that maybe I'm not where I want to be at in life. So I guess if
Yeah.
you're bored, you're almost like I should have something to do right now, right? I should be
Yeah.
working towards X Y Z goal. If you're bored, it's almost like this isn't good. What position am I? Because again, the world we live in, you have access 24 hours to information,
Yeah.
people. So think about even, I mean, time period of us growing up early when there wasn't social media as prevalent as it is now. You remember just the interactions with the people in your neighborhood or in that
Yeah.
vicinity, right? Now you literally look up and, oh, damn, that person's traveling here or that. Why am I not doing something actively in this moment, right? So I think it's
Yeah, that's a good
harder to
point.
be bored now.
Yeah, and that's what I'm saying. Like, I think we just need to start being okay with like not doing anything. But that was
How do you
okay.
encourage? Do
Cool.
you try to do that with your patients? Like encourage them to be bored?
I mean, I encourage a lot of meditation, breath work. I think it's easier to start with breath work
Hmm.
if you're an active person, like mentally, because um, counting breaths or whatever is, gonna take your mind off of the fact that you're not doing anything.
Hmm.
Exercise is a huge one, but I mean, I don't think that I wouldn't I would encourage moments of stillness. I tell people that if you are drinking your cup of coffee in the morning, just drink your cup of coffee. You don't have to have your phone outside with
Yeah.
you,
Yeah.
right? So I guess I mean it's not really encouraging people to be bored, but it's just like encouraging people to be okay not doing something constantly, right?
That's a
So
great point. That's a good point. Yeah.
yeah,
Yeah.
like you don't have to always have your phone on you. And if someone calls you, and I've learned this, even in the hospital, I used to like when the hospital would call me, I'd be like, yeah, gotta answer it right away. And now I'm like, okay, I'm talking to a patient. Let me finish talking to the patient and
Hmm.
I will call the hospital like back, whoever was calling me.
Yeah.
Right. But it was just like we just get so used to like doing things right away. It has to be right now. And
Mm.
now I'm like, no, like I'm talking to this person. Let me finish talking to this person. and be present with this person and then continue the next thing. So I don't know, but these are all things that you have to learn, I guess.
Yeah,
Uh,
it's but like you said, it's the laying out the pathway to, we know what it is. It's all about, can we find some constructive way to make, say, whether it's ourselves, family members, or our patients, be consistent with it. It's all about the plan, right? But that's the hard part, right? That's what the effort goes into. Yeah.
yeah. Okay. Well, all right. So we're gonna, I guess maybe close this up
Hmm.
with a question.
Sure.
Okay. So where are you, like mentally and physically, and where do you want to go? Like, what are your goals for yourself in this space?
Right now, I would say, again, first is attending, adjusting to everything. I'm in a good space. I would say even space, right? I have my days where it's not good, but I have my days where things are going really well, and you have those ever so often great days, right?
Hmm.
Where do I want to go? I mean, for me, it's to something we always talk about, just staying present in certain moments, right? It's something I have to keep reminding myself. I want to get it
Yeah.
to the point where I know that I'll still have to remind myself to a certain degree, but more consistent without, oh, David, you have to, David, just stop, just it's a part of my natural behavior, right? That's one major thing I want to take out of just me improving my mental health, my meditation
Yeah.
practices overall. Uh, the second thing would be just me, again, working on those defense mechanisms, just limiting that. And it's kind of how I grew up and how I got to be where I'm at, right? So I had to
Hmm.
like close off and shut off, but less of that. I am better at that now, but even more less of that, because I feel like, yeah, I'll get what I need to get done, but sometimes I can, affect relationships in a way
Yeah.
and it's never nothing, say, directly or personal, right? You know me, I'm more of I enjoy people. I want people to be happy around me.
Yeah.
But yeah, and that's I think the main two. And I mean, really just expanding and delivering information to anyone I come in contact with. Because again, going back to intern year, just being an intern and you have, say, seniors, people you work around with, people can make the work environment like a tight, tense situation, right?
Yeah.
I'm always like, I don't know what the hell that person's going through. I don't know what, but when someone's around me, I want to make sure they feel safe, because safety is always the key thing, but also just encouraged and, you know, because again, when we leave these different areas, whether it's work, whether it's say your church community, you have to go back to sit in that room and trying to be bored to a certain degree, right? And your mind's racing. You're already dealing with stuff enough on the outside, but when people are in my space, again, something to kind of ask you a question and finish off on, I want to get better or stay consistent with, being as genuine and being as comforting with friends and colleagues and people I interact with. Just increase that, I guess.
Yeah, I like that. Okay, so I think those are good. And then I just one more thing that because you said it, and I
Hmm.
think it's important for anybody listening and for yourself and myself to remember is when did I start that? You started residency, was
18,
it 2017 or 18
18.
that I gave that
Hmm.
talk. And okay, so I gave it in 2018. So it's been a while. But that your journey, right, towards this space of like peace and
Hmm.
working on your mental health, it's not linear at all, right? And so I think that that's one thing that I got wrong at the beginning was like,
Hmm.
when am I going to get to like XY,
Yeah,
right? Like you don't get there, like you're always striving towards it.
yeah.
And like sometimes you're like, wow, like I'm on top of the world, and then something happens and you're just like, oh man, I just went back like
No
a
problem,
thousand
yeah.
steps,
Hmm.
right? So it's just like to give yourself that grace that, I mean, it is your first year as an attending. That's huge.
Yeah.
So you're not going to get there wherever there is. It's just being the best that you can be while you're working towards that.
I like that. I guess too, and versus there, maybe you have a consistent space, or you've done the work so much to where I guess it's less effort, right? Or
Yeah.
things never get easier. You just kind of get better at doing, say, harder, difficult things, I guess, maybe, or I guess
Yeah.
looking at it in that way, right? But it's not an end point, right? Because things have
No, there is
changed.
no endpoint.
Hmm.
Yeah, and I remember getting so frustrated, like, oh, I'm not where I want to be. Like, and then it's just like that's constantly changing where you want to
Yeah,
be.
yeah. Jeez, man. Yeah. See, that's the thing we talk about, right? Being quote unquote enlightened. Now we're back to like, oh yeah, you can do all this, but you go back down to the bottom, right? I mean, I don't care. It's still, I think it's the effort put in is still worth it at the end of the day. I mean,
Oh yeah, so worth it.
yeah,
So worth it. I agree. I could never be that person that I was back then. I would probably be sick right now.
yeah,
Um,
yeah.
so I just want to thank you for coming on and taking
Thank you.
time to be with me. I think it's really important, to share our journeys, but also to correlate it with our patients, right? And so that people know that there is a link between your stress, anxiety, and your health, because I think that that often goes unsaid. And that, we're two humans who also have the same struggles, but we have found ways to manage it. And so thank you again for popping on with me.
Appreciate you having me on, and peace to everyone that's watching it.
Yes, thanks.